I am Dr. Srirang Abkari, consultant physician at UDAI OMNI Hospital, Chapel Road. Today I am going to talk about COVID-19, and all of us are witnessing a second wave of COVID-19. How is it different from the first wave? What precautions we need to take, and what things we should avoid doing so that we can take timely advice from the doctor and take appropriate treatment. All of us, when we get fever, cold, cough, sore throat, we would seek attention in terms of COVID symptoms. But there are certain atypical symptoms which might present as COVID. It may be vomiting, it may be loose motions, it may be abdomen pain, it may also be sleepiness, drowsiness in the elderly people, or some people may manifest with redness of eyes. Loss of taste and loss of smell is well known. So if anybody has encountered any of these symptoms in the present time, they should seek urgent medical attention and then take the advice of the doctor as to what next should be done. And when these symptoms are there, before you seek medical attention, we also would advise you to isolate yourself at home so that you do not spread the infection to others if you have one. Next, coming to the test for COVID-19, there are two types of tests which are available. One is a rapid test, the result of which you get very fast, and if that is positive, that can be taken as positive. But if it is negative and you have symptoms, you need to still again go for a RT-PCR test. The RT-PCR test is widely available, and can be reached in about 12 hours or so. Because of the heavy rush, it is taking maybe about 24 hours to get it reported. Next thing is, all people who are eligible for vaccination, I urge them to get vaccinated. But we need to also understand that vaccination does not prevent the disease or does not make you not transmit the disease also. So it reduces the chance of you getting the disease, and if you get the disease, it is likely to be a mild one. So please vaccinate yourself. Second important thing is, once you vaccinate yourself, do not throw all the precautions which you are taking before vaccination out of your daily habits. So use mask at all times when you go out of your house, maintain physical distancing, and then hand sanitization as usual should be continued. Remember that in the first wave, when we did not have a lot of medicines, when we did not have this vaccination, we still overcame that because we followed these three basic principles, namely of masking, physical distancing, and hand sanitization. So please continue them, and any doubt if you have regarding these, you need to consult your doctor immediately. And as there is an oxygen shortage going on, still remember that most patients, majority of the patients will have mild disease who do not require oxygen. Of the few with moderate disease where the oxygen saturation is low and require oxygen, oxygen will be available at low flow rates, and the government and the private sector, states, everybody is making an effort to ensure that oxygen supply is there. So please do not panic, and whenever you have signs and symptoms, please seek urgent medical attention so that you can be started on treatment early so that you do not progress to advanced forms of disease. Thank you.